Hello everyone, welcome back to the channel. Next Ben here, and in today's video we'll be talking about hypertension. So we have started a series where we are dealing with issues that affect the heart. We had previous videos on heart failure, and today we are talking about hypertension. To my returning subscribers, thank you for sticking along, and to all my new subscribers, we are grateful you decided to join this channel. Now on to today's video. Hypertension is usually elevated pressure within the heart vessels when it contracts and relaxes. So the pumping action of the heart, we know, allows for the heart to contract, to push blood out of it, and to relax in order to fill. Now the pressures within the heart when it does this is usually monitored. And then we've got two components of the blood pressure, which is usually your systolic blood pressure, which measures the pressure when the heart contracts, and your diastolic pressure, which measures the pressure when your heart relaxes in order to fill with blood. In order for us to understand hypertension better, we need to know what accounts for a normal blood pressure and what stages there are for someone to develop hypertension. So we mentioned that we've got systolic and diastolic pressure. So when we are looking out for hypertension, usually you want to look at both the systolic and the diastolic pressures, and then the numbers you get usually tells you the stage in which the person is. So usually for a normal blood pressure, you have a systolic of 120 and a diastolic of 80. I must say that blood pressure is very dependent on person to person. So even though we have the normal as 120 and 80, others may have slightly lower or slightly higher as their normal blood pressures. So we have four different stages of hypertension. We have your pre-hypertension stage, where your blood pressure is usually between 120 and 139 systolic, and then 80 to 89 diastolic. For stage 1 hypertension, your systolic blood pressure increases between 140 and 159, with your diastolic pressure ranging between 90 and 99. Stage 2 hypertension, on the other hand, is any systolic above 160 but below 180, with a diastolic above 100. And then we've got hypertension crisis, which is usually a sustained blood pressure above 180 systolic and 120 diastolic. Now, we've got types of hypertension, and the cause of the hypertension determines its type. We have the primary or essential hypertension. Usually, these are hypertensions that come about as a result of you being exposed to a risk factor. So, risk factors like age, we know older people, because of atherosclerosis, they are very prone to hypertension. We've got family history. So, if you have a family history of hypertension, you also have a tendency of developing hypertension in the future. Obesity, so individuals with high BMIs are also at risk of hypertension. Smoking, stress, excessive use of alcohol, hyperlipidemia, and increased salt and caffeine intake are usually risk factors that would cause one to get essential hypertension. So if your hypertension can be related to any of these risk factors, we say you've got essential hypertension. Then we have secondary hypertension, which is usually as a result of another disease condition. And so treatment for this type of hypertension is usually dependent on what is causing the damage. So you can have cardiovascular disorders, renal disorders, endocrine disorders, pregnancy. So most women will develop eclampsia and preeclampsia in pregnancy, and you've got some medications that can also increase your risk of having hypertension. Now, having understand what can cause hypertension and what it is, we also need to look at the signs and symptoms of hypertension. Now, the one thing I need to say is that hypertension is usually termed as the silent killer. The reason for this is that it is usually asymptomatic. So when you begin to develop hypertension, you are likely not going to see any signs that will point you to the fact that I may be developing hypertension. The only reason or the only way you can find out that you're actually developing hypertension is when you check your blood pressure regularly. But then when you begin to show certain signs which are very eminent, then we are looking at someone who is heading towards hypertensive crisis, because at this time your blood pressure is severely elevated. So we are looking at symptoms like headache, visual disturbances, dizziness, chest pain, tinnitus. You have a flushed face, and occasionally epistaxis. So when you start developing signs and these symptoms, then you have very severe hypertension and you need urgent medical attention. We did mention that hypertension is usually referred to as a silent killer, the reason being that you don't usually see signs and symptoms at the early stages of its development. But as a nurse, what assessments do you need to do that will give you clues of someone that probably could be having hypertension, or the things you look out for that would indicate that someone is having hypertension? The very first one is to look at the family history and any signs and symptoms the person may present. We mentioned that a family history is a risk factor for you to develop that. So once you know there's a risk, then it's always good to keep an eye for it. Now you want to check the blood pressure in both arms, and you want to do a sitting down blood pressure and a standing blood pressure. All you are trying to do is to look at the pressure in the different parts of the heart, and usually it gives you something to work with. So usually you want a baseline blood pressure, and then subsequent blood pressures can be compared to the baseline. We want to also identify in the current medication regimens. We mentioned that some medications can cause you to develop hypertension, so you want to assess medical history as well. The other thing we mentioned was the fact that individuals with a high BMI are prone to hypertension, and so you want to check the person's weight, calculate their BMI, and then advise them. We also want to evaluate our dietary patterns and our dietary intakes. When we were talking about the risk factors earlier, we mentioned that high salt intake, increased caffeine intake are things that could possibly predispose you to developing hypertension. So you want to evaluate the person's dietary intake. And finally, you want to assess neurology and renal function. Usually these ones are assessed at the later stages of the disease condition. The reason you want to assess neurological and renal functions is because with hypertension, you are at risk of developing strokes, and then you have your kidneys being affected as well. How do we manage hypertension? How do we treat hypertension? So the goal for management of hypertension basically is to reduce the blood pressure and to prevent or lessen the extent of organ damage. And you can either do this pharmacologically or non-pharmacologically. So for our pharmacological management, we are looking at the medications that we can use in the treatment of hypertension. So you've got your ACE inhibitors, your angiotensin converting enzyme inhibitors, and usually these ones end in PRO. So ramipril is a classical example of an ACE inhibitor. You've got your ARBs, which is your angiotensin receptor blockers, which ends in sartans. So your cardisartans are typical examples. You've got beta blockers ending in olol, so bisoprolol, metoprolol. You've got your calcium channel blockers. This one ends in dipane, so you're looking at your amlodipine, your nimodipines. You can also use the digoxin in the treatment of hypertension as well as diuretics. Now we're going to do a video where we talk into details of these cardiac medications used in the treatment of hypertension. Now, moving on to non-pharmacological management, usually you want to modify risk factors because we know that certain things can predispose you to hypertension. So if you do have hypertension, you want to see if you are actually involved in any of these things, and the plan is to modify to reduce. If not, if you are unable to stop, then you want to reduce it as much as you can. So the few things you want to do is you want to reduce your salt intake, your caffeine intake, and your alcohol intake. The goal is to stop this completely, but if you cannot, then the plan will be to reduce them in order to help lessen the effects of the disease condition. You also want to lose weight if you are overweight, and you want to encourage regular exercise. You want to teach on smoking cessation, teach on stress relieving measures, and then you want to watch your diet. One of the very important things that helps in the treatment of hypertension is patient education. Now, because hypertension and its management usually is a lifetime or a lifelong treatment, it is usually good to adequately educate your patient in order for them to understand the disease process, so they are able to follow the treatment plan or the regimens that is been given. So you want to educate firstly about the disease process. How does it come about? What are the things that causes hypertension? What the risk factors are? And then you want to now describe what the treatment plans are, and also teach the importance of adhering to these treatment plans. Now, teach how to monitor blood pressure. So it is easy for a person with hypertension to monitor their blood pressure at home. You also want to teach on risk factors and offer advice on how to modify these risk factors. Teach on the importance of reduction of salt or sodium in our diet, because sodium is a very big contributor when it comes to hypertension. We want to teach on the medication. So the one thing is that it's usually lifelong, and stopping abruptly will lead to something we call rebound hypertension. And usually with rebound hypertension, it is more difficult to treat when you fail to follow your treatment plans. And then you also want to stress on the need for follow-up. We need to constantly monitor you so we know if there are any changes in the disease process, and then what other treatment plans can be modified in order to keep your blood pressure under control. Having said this, it is important to know that it is an emergency when someone suffers from hypertensive crisis. Now, the name crisis rings a bell. It tells you that this is something that is very important and needs immediate follow-up. So usually, if left untreated, it can cause severe and organ damage. So we're looking at brain, kidney, and sometimes can even affect your eyes and your retina. So it affects your vision and can ultimately lead to death. And so what we want to prevent is a patient getting to the stage where they are in hypertensive crisis. So at what stage do we classify someone as being in hypertensive crisis? Now, when we looked at the stages of hypertension, we talked about hypertensive crisis, and we said that a sustained systolic above 180 and a diastolic pressure above 120 is indicative that the person is in hypertensive crisis. Now, what signs and symptoms would point you to this fact? Usually, you have a pounding headache, you become drowsy and confused, your vision is blurred, you've got changes in neurology, you become tachycardic and tachypneic. So you begin to now, your heart beats faster and you are breathing faster. This is because you want to keep up with the heart. You've also got dyspnea, that is difficulty in breathing. The reason is that because the heart is pumping so quickly, there isn't enough time for gas exchange to be occurring in the lungs. And so your body now lacks the oxygen it needs. And so you begin to turn blue, and you may occasionally suffer seizures as a result of being in hypertensive crisis. So because this is an emergency, what are the nursing interventions we need to be doing when we recognize a patient is in hypertensive crisis? Now, in health and in medicine, in nursing, the most paramount thing for everyone is to maintain a patent airway. So you want to maintain a patent airway above everything else, because you need oxygen to go into the bloodstream, and then you get that through a patent airway. So you want to make sure that the patient's airway is patent. Now, in order to do that, probably the patient, if is still not as confused and is able to follow commands, then you would give some oxygen. Otherwise, you are looking for an artificial airway. They are looking at intubating and ventilating the patient, just so we are able to take control over the airway, and then we can manage the hypertension better. The other thing we do is that we administer IV hypertensive. So usually for regular treatment of hypertension, you would have oral antihypertensives. But in such crisis, usually we give IV antihypertensive, so usually like labetalol, in order to bring the blood pressure down. And then once the blood pressure is down and stable, we now resume regular oral antihypertensives. You want to continuously monitor the blood pressure. So what you want to do is that if you have the luxury of an arterial line, you put an arterial line in, and then they give you a constant monitoring of the blood pressure. Obviously, this can only be done in the intensive care units, but if you don't have the invasive arterial lines, then you want to put a BP cap on, and then you want to continually monitor the pressures at least every 5 minutes, because that gives you an indication of whether the blood pressure is going up or it's coming down, and whether the treatment options you have are working, and whether you need to add more in order to get the blood pressure under control. You want to monitor your patient's neurological status. This is very important because with such high blood pressures, you are usually likely going to get some form of a hemorrhagic stroke. And so you want to monitor any changes in neurology, and you want to report it as soon as it is noticed. Encourage bed rest. So with hypertension, we know that more activity means that your blood pressure increases. So you want to encourage bed rest, and if possible, elevate the head of the bed up to 45 degrees. Now, because we are aggressively treating hypertension in this stage, we want to also assess for signs of hypotension. So because we are aggressively addressing it, there's a likelihood that the blood pressure may drop even further than you want it to do. So you want to assess for hypotension, and you want to report it when it's seen. Now, the other things you want to do is to insert a urinary catheter. The reason for a catheter is that once you've got a very high blood pressure, your kidneys then tend to excrete more water. So you tend to urinate a lot with a very high blood pressure. So in order to prevent the frequent visiting of the toilets, which would not even promote bed rest anyways, we want to input urinary catheter in order to monitor the urine output as well. And then you want to have your emergency trolleys around if you don't already have this. So in your emergency trolley, you've got your airway equipment, and then you've got your cardiac arrest equipment as well. So whichever one you may encounter, if the blood pressure is not resolved, then you can quickly grab onto the trolley and then address that. And then finally, you want to monitor a strict intake and output. And then you want to report oliguria to your primary healthcare provider. This is just because you don't want the kidneys to be affected very much. So if the kidneys are not producing urine, because they may have probably been damaged as a result of the high blood pressure, then you can adequately treat it. Thank you all for watching today's video. This is our NCLEX RN review on hypertension. I hope this video has given you value for your time on this channel. If you liked the video, kindly hit the like button, share, leave a comment down below, and subscribe to the channel, even as we bring you more series of reviews for the NCLEX RN exams. Thank you all, and we'll see you in the next video. Bye-bye.